Hello, my name is Maria Erica Lacerna, and I'll be discussing about the topic shingles, or also known as herpes zoster. First is the introduction. What is shingles? This image explains what shingle is. Shingles is a painful skin rash caused by the varicella zoster virus, the same virus that causes chickenpox. It is a type of herpes virus that causes both chickenpox and shingles. It is presented via dermatomal rash, which usually appears in a specific skin area supplied by one spinal nerve. And this is why it's often localized rather than widespread. Next is the varicella zoster virus. This is the causative agent or bacteria, a virus causes shingles. This picture shows the virus and its effects on the skin. This is the varicella looks like under the microscope, and this is the example of typical rash that it produces when it infects the body. Now let's go to its habitat. This virus only lives and infects humans. After a person is first infected, like having a chickenpox during childhood, the virus doesn't completely go away. It hides in certain nerve cells along the spinal nerves in the spinal cord. Next is the causes, signs, and symptoms. What causes shingles, or its etiology? Shingles is caused by the same virus that causes chickenpox, called the varicella zoster virus. After someone recovers from chickenpox, the virus doesn't leave the body but instead becomes dormant or inactive in nerve cells. The virus can reactivate years later, causing shingles. This usually happens when the immune system weakens. The most commonly affected areas are the eyes, neck, chest, and abdomen, but it depends on the dermatomal level which is being attacked by the virus or it affects. Symptoms leads to red fluid filled sacs called blisters on the skin. The virus travels along nerves causing pain, and the formation of these blisters over time dry out and form crust. Overall, shingles occurs due to the reactivation of the chickenpox virus, resulting in painful skin blisters. This slide shows how chickenpox can lead to shingles. What happens inside the body? Varicella zoster lives in dormant state inside the body, and the outside of the body, most commonly rash occurs in the single strip around either the left or the right side of the body. In other cases, the rash occurs on one side of the face. Other symptoms of shingles can also include loss of vision, fever, headache, chills, and upset stomach, which will be discussed about later. Next, symptoms. Rash development. Shingles causes a painful and itchy rash that appears on one side of the face or body. Early symptoms, and before rash appears, you might feel burning, tingling, or sharp pain. The skin may also become very sensitive to touch. When the rash develops, it consists of groups of blisters filled with fluid. These blisters typically scab over about 7 to 10 days and held in 2 to 4 weeks. Common areas affected, like the chest and back, but it depends on what dermatomal level it affects. Other symptoms include people might experience fever, headaches, feeling very tired or fatigued, and swollen lymph nodes. Post-herpetic neuralgia, some people could have long-lasting nerve pain even after the rash goes away, which can last months or even years. In special cases, there are particular form called herpes zoster ophthalmicus that can affect the eyes and potentially lead to vision loss. These are the slides about the symptoms and signs of shingles. Next is the pathogenesis and virulence factors. Let's take a look at this slide. This slide is about how the varicella zoster virus behaves in the body. After the dormancy of chickenpox, the virus hides in the nerve roots. It can wake up and cause issues, again, due to stress, weak immune systems, or getting older. Symptoms are said before, when activated, it travels along nerves to the skin, causing a rash known as shingles. The virus stays hidden in specific nerve areas after chickenpox. After the decline of immunity, reactivation occurs and happens as our ability to fight infections decreases with age or due to other health issues like cancer or other immunocompromised illnesses. This small diagram explaining how the virus enters the body, spreads through the bloodstream, and causes illness, particularly in children with mild symptoms, and a rash. It also notes that the virus can be more severe in adults. This image provides an overview of the herpes zoster. And you can see in this slide, this represents the location or the areas where the rashes occurs when the virus affects the skin later on in adulthood. Next is the virulence factors of the varicella zoster. Varicella zoster's virus ability to establish latency, evade immune responses, and spread effectively are key virulence factors that contribute to its ability to cause both chickenpox and shingles. First is establishment and maintenance of latency. The virus infects nerve cells and hides in them. It stays dormant in sensory nerve clusters, or also known as ganglia. Certain triggers can activate the virus. It can alter cell behavior to maintain its presence too. Second is the immune evasion. The virus has proteins like glycoprotein E that helps it avoid being attacked by the immune system. It can inhibit immune responses and manipulate T cells, which are important to immune defenses. It uses cell processes to survive and replicate. Next is the spread within the body. The virus can spread from one cell to another. It uses glycoproteins to enter cells and infect them. It has a preference for skin and nerve cells. It can form vesicles or small fluid-filled sacs as it spreads. This also compares chickenpox and shingles, showing where the virus resides and how it manifests in these conditions. Next is the transmission and epidemiology. Let's take a look at the transmission of shingles. This slide explains how shingles spread or being transmitted. Stress or weakened immune system can activate the virus, leading to it to travel along the nerves and causes rash. How it spread? Via direct contact and airborne. Direct contact, touching the fluid from shingle blisters, can spread the virus, specifically to people who haven't had chickenpox. Airborne, sometimes the virus spreads through the air if a person with shingles coughs or sneezes. Contagiousness. Shingles isn't itself directly contagious, but the virus can still spread and cause chickenpox in others. It's termed non-contagious, but it is communicable, meaning it can be transferred but not in its current form as shingles. Incubation for chickenpox or the virus. After exposure, it takes 10 to 21 days for chickenpox symptoms to appear if someone gets infected. Next is for the epidemiology. It is a health concern worldwide, typically affecting older adults and those with weakened immune systems. There are vaccines to prevent it, but not everyone has easy access to them. Statistics shows about 1 in 3 people will get shingles at some point. In the USA, there are around 1 million cases annually, especially in older adults. This graph shows how shingles cases increases with age across different countries. The main message here is that shingles is a common, especially among older people, and vaccination can help, but access is an issue. Next is the culture and diagnosis. For the culture laboratory, this slide is about different tests used in laboratories to study infections, specifically for the virus that causes shingles. First is the polymerase chain reaction, or the PCR. This test finds VCV DNA in samples from things like blisters or scabs. It's the preferred method because it's very accurate. Next to it is the serologic testing. This detects antibodies, which are substances your body makes to fight infections. It helps see if someone has immunity or had the infections before. Next to it is the direct fluorescent antibody, or the DFA. This test checks lesion samples using special dyes to see if the virus is present. Next is the viral culture, wherein this method grows the virus from a sample. It's less accurate and slower, so it's not used often. Lastly is the Zank test. This shows if there are certain large cells but cannot tell the difference between the varicella zoster virus and the herpes simplex virus. For the diagnosis, this image explains how the doctors diagnose shingles. For the clinical signs, doctors look for a special kind of rash and ask about patient's medical history to identify the condition early for better treatment. The diagnosis mainly relies on finding a one-side rash and pain. Tests used are the PCR, the DFA, and the serology, and as well as the viral culture. Always remember that early diagnosis can lead to quick treatment, reducing illness, severity, and complications. Prevention and treatment. This picture is about preventing and treating shingles. First and foremost is the vaccination. A vaccine called Shingles is recommended for people over 50 and those with weakened immune systems. An older vaccine, Zostavax, is less effective and not widely used now. Vaccination helps lower the risk of getting shingles and a long-term pain condition called post-herpetic neuralgia. Next is the medications for treatment. Antiviral drugs like cyclovir and valcyclovir should be taken within 72 hours of rash appearance to reduce the severity. Corticosteroids can help with immediate pain but don't prevent long-term pain issues. Topical creams and ointments. Pain can be managed with painkillers like NSAIDs, or if needed, stronger medications will be used. If the eyes are affected, seeing a specialist will be important and recommended. Overall, the focus is on getting vaccinated and early treatment to manage and reduce symptoms effectively. Thank you all for listening and watching. I do hope that you find good information regarding my topic, shingles, or also known as herpes zoster. And these are my references. You can go to these links, and if you want to know more about shingles and herpes zoster. Thank you very much again, and have a great day.